zany as it can be.
Today I'm going to demonstrate how to take vital signs, which are essential indicators of a person's health. Vital signs include temperature, pulse, respiration, blood pressure, and oxygen saturation. Knowing how to measure these can help detect health issues early on, whether in a healthcare setting or at home. Let's get started. The first vital sign is temperature, which reflects the balance between the heat our body produces and loses. We can measure temperature orally, rectally, via the ear, under the arm, or on the forehead. The normal oral temperature range is 36 to 38 degrees Celsius, 96.8 degrees to 100.4 degrees Fahrenheit. Rectal and ear temperatures are slightly higher, while axillary temperatures are lower. To take an oral temperature, ensure the thermometer is clean and that the person hasn't had anything hot or cold recently. Place the thermometer under their tongue. Wait until it beeps and check the reading. This step can help identify fevers or other health concerns. Step 2 is measuring the pulse. Pulse measures heart rate and rhythm. To take it, locate the radial pulse on the wrist by placing 2 fingers just below the thumb. Count the beats for 15 seconds and multiply by 4 to get beats per minute, or count for a full minute for accuracy. A normal resting pulse rate for adults is 60 to 100 beats per minute, and any significant deviation could indicate a heart issue. Measuring respiration. Respiration is the rate of breathing and is a key indicator of lung function. To measure, watch the chest rise and fall, counting each breath over 1 minute. Try not to alert the person, as they may change their breathing if they're aware. A normal adult breathes 12 to 20 times per minute. Fast, slow, or irregular breathing can signal respiratory issues. Checking blood pressure. Blood pressure measures the force of blood against artery walls during heartbeats, which is systolic, and rest, which is diastolic. To take it manually, you place the cuff snugly on the upper arm, inflate it, and use a stethoscope to listen for the first and last beats as you deflate. A normal reading is around 120/80. Deviations can indicate conditions like hypertension or hypotension. Today, like most hospital settings, we will just use a electronic pump. Place the cuff on the arm with the arrow over the brachial artery. Tell the patient not to cross their legs and to keep their arms straight. Finally, let's look at pulse oximetry, which measures the oxygen level in the blood. A pulse oximeter is a small device placed on the fingertip, which gives a reading within seconds. Normal oxygen saturation is generally between 95% and 100%. Readings below this range may suggest respiratory issues, particularly in people with chronic conditions. To recap, we've covered temperature, pulse, respiration, blood pressure, and oxygen saturation. Each of these vital signs provides important health information. Taking them accurately and regularly can help detect issues early. Thank you for listening, and I hope this overview has been helpful for understanding the basics of vital sign assessment.